Subluxation is a fancy term that's used to describe what happens when the spine, over repeated stresses, begins to develop inflammation and swelling on different levels of the spinal cord, the nervous system. And so it describes a distortion, spinal misalignment that will begin to happen as a result, certainly of physical stresses. Now, when spinal distortion develops, it always attracts muscle spasm, which is very inflammatory in nature. And when inflammation combined with muscle spasm begins to settle into the spine, we also know that scar tissue will develop within a relatively short period of time. And as scar tissue develops in the spine, it causes more distortion, more inflammation, more pressure to the spinal nerves, and we call that subluxation. One of the first stages is what we talked about, the muscle spasm and inflammation. Now that can actually start to cause a stress and a tension to the spine and cause more distortion to the point where the actual curves in the spine are starting to change and become altered from the normal ranges. Phase 2 now begins to show more signs of scar tissue, inflammation, muscle spasm, but on X-ray we actually can start to measure a decrease or a compression, a deterioration, if you will, between the vertebrae on those discs or those cushions that we have between the vertebrae. And those cushions and discs now begin to deteriorate and become smaller over time. As that happens, we start to reduce the size of the nerve canal through which those nerves are passing. And those nerves are carrying information from the brain to different cells and organ tissue in the body. Phase 3, we're starting to now see calcium deposits, spurring, lipping formation on the edge of the vertebrae. The cushion, the disc, is becoming smaller. It's now actually what some people might refer to as a degenerative disc disease or arthritis. By the time we get into phase 4, typically we don't see those patients that often because disease and a sick spine that's taking over creates a lot of health issues. But that spine is now typically fused and is beyond chiropractic help. Every cell and organ system in the body receives a nerve supply. And so to the degree that we begin to interrupt and interfere with signals going to those organ systems, we start to reduce the efficiency of that organ system. So our heart receives thousands of bits of information every second from the brain through the nervous system. Our liver, our digestive system, our reproductive system, our kidneys, our bladder receive information. So as more and more cells that are not receiving information from the brain start to die off, it interrupts and interferes with that organ's ability to operate.